Have you experienced a stroke and now can't move one side of your body? Well, today we're going to talk about something very important for stroke recovery: how to get your affected side to move again. Whether you're just starting out or looking to regain more control, we're here to share 5 simple tips and techniques to help get you moving. Remember, every small movement counts and consistency really is the key, so let's jump right in. We're going to go through 5 different tips. Our first tip is to start with passive or active movements. This means moving the affected arm or leg with help from either your other hand, a caregiver, a resistance band, or belt. The goal is to use your muscles as much as possible to move all body parts affected and help each body part as needed. Passive movements are a great way to keep your muscles and joints flexible, even if you can't move them on your own just yet. Make sure to move slowly and gently, never forcing any movement. Try practicing a few minutes each day to increase flexibility and prepare your muscles for more active movements. Next, let's move on to tip number 2, the power of visualization. It might sound surprising, but research shows that mentally imagining movements can help strengthen your brain's connection to the affected side. For example, if you're working on lifting your arm, try closing your eyes and visualizing yourself doing that movement as vividly as you can. Another option is performing something called mirror therapy. To perform this, your affected or weaker side will be behind the mirror, as shown in this video. You will then move your stronger side as you continue to look at your body part in the mirror. You must keep looking at the body part in the mirror to be effective. This technique helps engage the brain in the same way actual movement does. So even if you're not yet able to move that limb fully, you're still strengthening the connection by imagining it. Tip number 3. Let's talk about adding small exercises to your daily routine. Short, frequent practice sessions can be much more effective than one long session. If you're working on moving your arm, try raising it gently during daily tasks, like reaching for a cup or lifting a book. Consistency really makes a difference. Even if it's just for a minute or two, several times a day, your brain starts to learn and relearn those movements, building strength and confidence over time. Tip number 4, use tools to help. Sometimes items like a rolled up towel, resistance band, belt, or even household items can help support movement and make exercises more comfortable. For example, a rolled towel can support your arm during seated exercises, helping you move without straining. Using props can make it easier to practice certain movements and reduce any discomfort so you can focus on strengthening. Our final tip is all about mindset. Stroke recovery can be challenging, and it's important to stay positive and celebrate each small win. Maybe today you lifted your arm a little higher than yesterday, or maybe your fingers felt a bit stronger. These are real achievements, so take a moment to appreciate them. Recovery is a journey, and every little step is a victory worth celebrating. Small improvements add up over time, so keep going and don't get discouraged. To recap, the 5 tips are: number 1, start with passive or active movements. Number 2, use visualization techniques. Number 3, incorporate small daily exercises. Number 4, use supportive tools or props. And number 5 is stay positive and celebrate the small wins. We hope these tips give you a helpful starting point to regain movement on your affected side. Remember, with patience and persistence, progress is possible. If you found this video helpful, please give it a thumbs up and subscribe for more tips and support on your recovery journey. Feel free to share this with anyone who might benefit from these tips. And as always, thank you for watching. Keep working, stay positive, and we'll see you in the next video.